Click link in description to learn how to protect your family from a virus pandemic. What to do in COVID-19 pandemic. The World Health Organization has declared COVID-19 coronavirus a pandemic. The threat of a disease spreading across the globe should be taken seriously. There are real, actionable things you can do to soften the impact a pandemic might have on your life and those you care about. Keep in mind that respiratory viruses, such as COVID-19, can be the cause of a pandemic, but pandemics can also be transmitted in other ways. How to prepare for a pandemic. Just like you might prepare for a hurricane or an ice storm, you can prepare for a pandemic, too. Staying informed, making plans, and stocking up on essentials can go a long way to helping soften the blow of a pandemic if and when its impact begins to affect your community. 1. Keep calm. Pandemics can be nerve-wracking, especially if you don't know what to expect. But try to keep a cool head. Panicking can sometimes cause people to freeze up or make rash decisions that put them at unnecessary risk. Even if things feel out of your control, there are steps you can take to prepare. Focus on that. 2. Stay informed by reliable, fact-based sources. Accurate information is crucial during, and leading up to, a pandemic. Having solid intel can help you make sure you're doing the right things to stay safe and understand what risk, if any, there is for you and your family. But it's not always easy. In the early stages of a pandemic, there are often a lot of unknowns. It might not yet be clear what the pathogen is, how it spreads, or who is most at risk. While researchers and health officials work to find answers, misinformation and rumors can fill in the information gap. That can lead people to forego appropriate preparations or cause widespread panic. Protect yourself from inaccurate or misleading information by visiting the websites of health agencies like the Centers for Disease Control and Prevention (CDC), the World Health Organization (WHO), or your local health department to find information on who is at risk and how to protect yourself. Being a little skeptical of things you read online or hear from friends or family until you're able to verify the information is correct by using a reliable source like the CDC. Listening to experts in infectious disease, like scientists, health officials, or healthcare providers, rather than celebrities or cable news commentators. 3. Stock up on essentials. During a pandemic, you may want to reduce grocery runs to avoid exposure to people, or stay at home to protect others if you do get sick. Supply shortages and cleaned-out store shelves might also make it tough to find what you need in the moment. Keeping extra essentials at home can help ensure you have what you need, when you need it. Here's what you should have on hand: 2 weeks worth of food and water for everyone in your home, including pets, a continuous supply of prescription medications. You might have to get special approval from your healthcare provider and/or insurance company to do this. A first aid kit and non-prescription medications, such as fever reducers and pain relievers, rehydrating fluids, vitamins, and cough or cold medicines, hygiene products, including 2 to 4 weeks worth of hand soap, shampoo, deodorant, diapers, and tampons or pads, cleaning supplies, including trash bags, washable rags, and disinfectant and/or bleach. You don't have to run out and buy everything all at once. But if it looks like a pandemic could affect you or your community, you might want to start buying a little extra every shopping trip, if at all possible. 4. Make a plan. Things can move quickly during a pandemic. Make plans for what you will do in the event you or your family are stuck inside for days or weeks. For example, have some inside activities planned, especially if you have young children. Large-scale quarantines can slow everyone's internet connections from congestion, so don't just rely on streaming videos and online games for entertainment. You're off work for days or weeks because you're sick or businesses are shut down. This is especially important if you do not have access to paid sick leave or you are paid hourly. If at all possible, try to save up enough money to get you through gaps in pay, and if you can't, confirm where you might be able to turn for support. Schools or child care facilities close, and you need alternative child care. Be aware of whether your primary or backup child care might be at elevated risk for disease, such as elderly grandparents. You get sick and are unable to care for someone who relies on you, such as a child or an aging family member. You depend on someone else, and they get sick or are otherwise unable to care for you. Your healthcare provider is unable to see you or a family member if you get sick. For example, it might be helpful to look into what other healthcare providers are covered by your insurance, or whether there are affordable telemedicine options available for you. You have an anxiety disorder or other mental illness that could be exacerbated by a pandemic. Talk with your healthcare provider or counselor about what techniques you can use to manage symptoms, especially if your usual coping strategies, such as going to the gym or support group, are unavailable. All of these will be easier if you're in good contact with friends, family, and coworkers. It doesn't hurt to check if your neighbors and family members feel prepared. Disruptions will likely be more manageable if people support each other and look out for one another. Click link in description to learn more about how to protect your family from a virus pandemic.